Our next speaker is Huifang Wang, who's going to talk to us about virtual brain twins for stimulation in epilepsy. Dr. Wang specializes in personalized whole brain modeling through virtual brain twins for clinical applications in epilepsy. She's a leader of the DEPTH group in Aix-Marseille University, and is developing new approaches to modeling brain stimulation in epilepsy and a number of other clinical conditions as well. And we had Huifang speaking yesterday, so I know she gave a fantastic talk. Take it away, please, Huifang.
Good morning, everyone. Thank you for the invitation. And so today I will talk about virtual brain twin for stimulation in epilepsy. What I will talk about, the concept of what is virtual brain twin and how to construct it and its application in epilepsy. I gave two examples. One is for SEEG stimulation for the invasive approach, and then temporal interference for the non-invasive stimulation. So, and what is a virtual brain twin? Another name is personalized whole brain network model. So we start with the patient's brain here, and we want to build this model. We call it virtual brain twins. Use patient's data. Patient's data include the anatomical data and the functional data. And from this data, we have models. We want to inform what is the parameters for these patients. So we call it twins. So this is like the three characters of a virtual brain twins. The first step is about personalization. And once we have these virtual brain twins, we can put the different, for example, different stimulation there, and then the patient, we can simulate the brain activities under the different stimulation. So we call it the second one. We can generate the new data, and then this is we call it prediction. We can predict the different brain activities under the different stimulation parameters. And then imagine if the patient has under the medication or the deep brain stimulation after 1 year, the brain is changing, so the twin should be also adapt to the parameters changing also. So this is the third one is adaptive. So this is what about virtual brain twins. And let's go to the stimulation. And the typical answer we want to, questions we want to pose here is like, can virtual brain twins can help for the diagnosis and treatment? And for example, for epilepsy, the diagnosis can be like epileptogenic zone. Treatment, it can be cure the seizure or just reduce the seizure rates. And then the second one, once we achieve the first one, maybe we want to know what is the best parameters we want to stimulate. Stimulation parameters is include where we should to stimulate and what is the intensity and what is the frequency. So here today, I will talk about how to construct these virtual brain twins, and two examples for SEEG stimulation and TI stimulation. And then if you know our work about virtual brain twins, and we go through clinical trial for identify easy network right now, and then this is in the low resolution. So now it's the first pipeline we work on the clinical, clinical use for the high resolution for stimulation. Why high resolution is important here? Because we want to calculate the electric field. So this spatial distribution is important, becoming important right now. We cannot average as one node here. So this is, today I will guide you through how we build these virtual brain twins and in the high resolution. So the first step is how to construct it. So we construct all these vertices is about 260,000 vertices for the whole brain. This geometry of the brain is come from the patient's T1 scan, MRI scan. So we reconstructed it, and then we introduced like diffusion MRI. They got like whole brain network modeling from the different nodes, different brain regions. This is white fiber tracks, and from this geometric, and consider about these patients geometric here, and then we build up this local connectivity. So we consider about all this information from anatomical information for this patient, and we build the virtual brain models here. So this model, we call it neurofield modeling, and then this is the local effect here. It's on each vertices right now. It's not in the node, it's one vertices. And then we consider about both global connectivity through the white fiber, and then local connectivity is this geometric information from this local and the propagation, and put it here. And also we put the noise here. So this is one equations models, and then we put on each vertices. They have like 260,000 vertices put here. And then we can do the whole brain simulation. It looks like this one on the top. So we can highlight to see like how seizure propagate through these brain regions, rhinal cortex. And then what we can observe is through the EEG or SEEG, the sensor models. So we need to map our this source level to the sensor level. And then after we have this, and then we can, right now we can match our models from the sensor data. This we can observe for the epilepsy patients. Here we use SEEG sensor level, and we attract the data feature from this functional data, and we use a machine learning method. And here in our lab, we normally use the Bayesian inference method, and then try to identify the easy network, where the easy network for this patient. And then we can put the stimulation there. So for example, like this is SEEG stimulation, like the electrode node here. And then we calculate the electric field, and then we put like this term, the stimulation term in our models here, and then we can predict what is brain activity looks like for the sensor level. So it's like this 5-step, like a recap. And the first one is to do the structural scaffold. And then the second step, we put these models here. And the third one, we map this model from source to sensor. And then we do the model inversion to get these patients' specific parameters from functional data. And then we do the prediction. Under the different stimulation, we got this prediction about the brain activities. So now we go to like how to model the stimulation effect. And then this, I gave example from SEEG stimulation. There is 2 electrode, and we put like this is location. We put the stimulation there, and then it's like this is the real stimulation. Looks like this is recording from one patient's data, and then this is recordings. You can see pong 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 after 19 seconds they induce the seizure. So in the routine, they try to induce the seizure in order to know what is the easy network it is. So the stimulation parameters here, we normally include where we want to stimulate, and then frequency we stimulate, and then amplitude. So I will go here then we went through the literature from experimental data, also our patients' data. We found this accumulated effect we put in our models. And then after we put our models, we want to test on the real data. So here you can see like this is like for the real data is here, the recordings. This is what our models do. And then you can see like when we do like 1 Hertz, 1 MA, so there is nothing happens. And then there is like if we increase the intensity, and then like it's induced the seizure from our model, and then compared with the empirical data. And then if we increase the frequency, the seizure patterns is different, propagation also different, so we can see from our models. And then once we have these models, we build on our virtual brain twins. So as what we already showed, like from the structural data and the functional data, we build these high-resolution personal models for stimulation here. And then we put our stimulation, the parameters here as EEG stimulation. We build our twins here, and then we map for the SEEG recordings and the SCOP EEG recordings. So we put together, we try to identify what is EEG network look like. And then I just gave one example for this patient, and we have the stimulation here. We have the electrode here, and then this is how like the source activity looks like. And you can see like it's a stimulation, and then like this is brain activities. And then we map it back to like SEEG and EEG, and we do the model inversion. We got the EEG network here. And then the second thing, we can use the same thing for the TI stimulation. What is TI? I think Daniela will go to the deep. So here I just gave like one introduction. Imagine there is two electrode pairs. One is 1,000 hertz. Another one is 1,005 hertz. And what is matters is not the 1,000 hertz, it's like these 5 different hertz is matters. And we think it can go to the deep structure and then can go local. So this is the reason we choose it as the one example, the future direction we are working on for the non-invasive stimulation. We put the stimulation there from our models. Our models can go the SEEG recording, the EEG recordings, so we can do the same thing for the model inversion to identify the EEG network. So here is like we stimulate this 4 electrode, the electric field looks like, and then the source activity looks like, and then I will go for the timing, and I just go. And the SEEG recording, EEG recording, we try to identify what is EEG network. So summary, and like this is like the first pipeline we built for the stimulation for the epilepsy, use a high resolution, and there is still a lot things we need to do along this journey. There is a lot of challenge as well. So what we already done for on this paper, I think will be this morning I got to the DOI, so it should be like you can access it in 1 or 2 weeks. So there we can have like high resolution and personalized modeling for the stimulation, SEEG and TI stimulation there. And then also like we can put the different modality there, EEG, SEEG. And then it's also like you can find like the local connectivity is heterogeneous. It's different brain regions can like change it. And if you want to try the different atlas, you can try the atlas. Also like we open all the code here. Like this code is like in the GitHub code is here. But if you just want to run it, you don't want to like to set up your computer, and then there is 2-part code in the code ocean. You can just run there. And then like in our lab right now, we also trying to like focus on the optimize the stimulation parameters and go beyond the diagnosis to do the treatment. And we also work on the deep brain stimulation and all non-invasive stimulation for TI stimulation. And then we go to the different functional modality for the stimulation, this part for the virtual brain twins. I will skip for where we are for the virtual brain twins, but I want to thank for your attention for all the team at home to make it work. So thank you.